Hello, everyone, and hello, all of my peers, as well as my professor of sociology of nutrition. This is Lauren Jenkins, and for my final project, I have the opportunity to speak on the social ecological framework of African American women's infant feeding choices. In Park Wild's book, Food Policies of the United States, he brings attention to many economic principles, policies, as well as nutrition science, and a broad introduction to food policies in America. He also introduces a model of the social ecological framework on nutrition and physical activity decisions. From a education, just wanting to learn to gain knowledge, but also from a personal position, being that I'm expecting my first child this summer, I wanted to explore the social and environmental factors that influence the best breastfeeding practices of African American women. So, research conducted over the last 25 years confirms that breastfeeding has positive effects for mothers and their children from not only a nutritional standpoint, but psychological as well as just developmental perspective. Statistically, over the last several years, we have seen that the overall breastfeeding rates in the United States have increased. Research, social awareness, and legislation are just some of the factors contributing to this rise. While many breastfeeding initiatives throughout the United States and our population are seeing increase in breastfeeding, one group of American women still fall behind. That group is the African American female population. So why are we seeing disparity of breastfeeding amongst African American mothers? Well, let's take a look at some statistics. So, before we jump into some of the reports and information that I've explored and researched, here's some things to know about breastfeeding in America. As I mentioned, it has positive effects. Breastfeeding rates in the United States have increased, and research, social awareness, and legislation are just some of the factors who've contributed to that rise. So, this is what the Centers for Disease Control mentions. According to the Centers for Disease Control in 2010, breastfeeding rates by race in the United States continue to show a marked disparity in African American women as compared to white, non-Hispanic, Asian, American Indian, as well as Hispanic women. They also show a shorter duration of breastfeeding after 6 months of giving birth than their non-black counterparts. We also see in the Surgeon General's call to action to support breastfeeding that came out in 2011, it also discussed the disparities in breastfeeding practices amongst African American women. It states that despite overall improvements in breastfeeding rates, unacceptable disparities in breastfeeding have persisted by race, ethnicity, socioeconomic characteristics, and geography. For example, breastfeeding rates for Black infants are about 50% lower than that of white infants at birth, ages 6 months, ages 12 months, and even when controlling for the family's income or educational level. On the other hand, the gap between white and Black mothers in initiating breastfeeding has diminished over time from 35% in 1990 to 18% points in 2007. So for the purpose of my project, I want to explore the barriers of African American women when it comes to engaging in breastfeeding practices. Two areas that we're going to explore on the social ecological framework model are the cultural and social factors that contribute, as well as environmental settings. So let's take a look at some objectives. So, throughout this presentation, I hope to identify the social and cultural factors that contribute to African American infant feeding practices, as well as identify the environmental settings that impact African American women in their infant feeding practices. Also, we're going to explore resources and information to aid and promote healthy breastfeeding practices for African American mothers. All right, so let's get started. All right, so we're looking at our social and cultural factors that contribute to African American infant feeding practices. So, in regards to some of these social and cultural factors, I'm going to highlight three significant ones. We're going to talk about belief systems, lifestyle choices, and family influence. So, based on some of the research that I have found in regards to barriers to breastfeeding, African American participants in a study that was done in North Carolina, but also there was a group that was assessed in the state of Maryland. They had, throughout a survey, disclosed that some of their concerns about nursing or breastfeeding were due to latching challenges, lack of knowledge, and breastfeeding interfering with other activities. So, as we look at our Venn diagram here in regards to the social and cultural norms and values, we see belief systems, we see lifestyle and personal choices. We highlight certain lifestyles that many had disclosed in their survey. For example, some mothers enjoy smoking and drinking alcohol. We also had mothers who had some medical health issues. And then we dealt with family influences, where, again, in certain cultures, they disclosed that using formula was the best practice that they used within their culture and family setting. Within my research, I also came across that African American participants disclosed that they chose bottle feeding over breastfeeding due to fear being a main factor. This goes into our belief system component in terms of how it impacted their decision. They stated that they believe and then experienced that breastfeeding was painful, that there was inadequate time for it, and that it was incompatible with their personal health habits and just uncomfortable with the idea. And this can be found in the article by Spencer and Grassley from 2013. With regards to lifestyle and personal health choices, um, some mothers indicated that participants again enjoyed smoking cigarettes and consuming alcohol. In regards to health, statistics have shown that African Americans in the United States have a higher risk for many diseases and higher incidence of many chronic health conditions that led to poor health outcomes when compared with their white and the Hispanic populations. Regarding heritage, family influence is definitely a factor. Many participants, as mentioned, discussed that their mother raised them as an infant on formula. And while some had mentioned about breastfeeding, many discussed how their families use formula. So let's take a look at some environmental settings that impact African American infant feeding practices. Three areas we're going to explore are the workplace, public settings, and the communities in which we live in. So with regards to barriers in regards to environmental settings, in an article by D. Street and Llewellyn, 2013, some African American female participants discussed that workplace environment presented challenges with regards to returning to work and being able to maintain breastfeeding practices. Some suggested that maintaining breastfeeding while returning to the workplace was not conducive to their schedules or the workplace environment. Some Black women in the study said they would prefer bottle feeding because that was more suitable when they would place their children into daycare or due to the hours in which they worked in terms of returning to work. So let's take a look at the Venn diagram that looks at the different environmental settings. So workplace. We have women who do shift work, so some of their schedules are a bit inconsistent, or the standard 9 to 5. We also have things with public breastfeeding. One of the challenges for many years is that it was not permitted in terms of having the support through law legislation. In the latter part of this presentation, we'll be able to see how now states have laws that support and encourage breastfeeding practices. Regarding environmental settings, specifically within the living environment, an African American's decision to breastfeed expounds upon breastfeeding in public settings, and it focuses on community-based breastfeeding support throughout the areas that we all live in. So many places have programs like WIC or other services that promote healthy breastfeeding practices amongst just people, and specifically African American women in low impoverished areas. These services provide educational materials as well as make services accessible to the population in which they are trying to encourage healthy breastfeeding practices. So, to combat some of those barriers that many African American women throughout the research and articles read to create this presentation have disclosed and discussed, I'd like to spend this next section about talking about the information and resources that are available and have been provided to aid and promote healthy breastfeeding practices for African American mothers. So throughout my research, these were a few things that I came across. There's a guide that was put on by the Department of Health and Human Services, Your Guide to Breastfeeding for African American Women, Why It's Important to Breastfeed. They send out different types of materials that are free and available and accessible, not only printed, but also online. And I've attached this to my presentation. The other thing is just living in the state of Maryland. Maryland has a coalition called Maryland Breastfeeding Coalition. We also know about WIC and then other resources that are available that educate mothers about why it's good for a baby to and a mother to breastfeed. So here's another thing in terms of legislation. President Obama in 2010, March 30th, 2010, signed the Affordable Care Act, in which this act and this law required an employee to provide reasonable break time for an employee to express, to be able to pump and express breast milk for nursing her child 1 year after the child's birth. And so that's very interesting to know. In addition to the Affordable Care Act, many states have legislation in place. About 49 states, including the District of Columbia and the Virgin Islands, have laws that specifically allow women to breastfeed in any public or private location. Maryland and the state of Virginia are also included in that. 29 states, the District of Columbia, and the Virgin Islands exempt breastfeeding from being a violation of indecency or public indecency laws. And the state of Virginia falls into that as well. So let's take a look at some legislation. So, Virginia breastfeeding law. Virginia Code 2.2-1147.1, which was put into play 2002 and then revised, guarantees a woman's right to breastfeed her child at any place where the mother is lawfully present, including a location where she should otherwise be allowed on the property that is owned. Okay? State of Maryland, also, the General Health Code permits women to breastfeed her infant in any public or private place and prohibits anyone from restricting or limiting that right. So, this concludes the information in regards to my presentation. But I do want to say, as a mother or soon to be mother, I think that this is wonderful, and it provided me insight and awareness in regards to this topic. I hope that my presentation has brought awareness and insight to others, and I thank you for your time. Here are my reference page, so you can see my references that I've used, and then I will attach this to my blog and will also attach the resource about healthy breastfeeding practices. Thank you and have a great day.